The men think that they always strong and they like superhero and all the disease cannot touch to them. During his life, he don't get any checkup. But when something wrong happen, the man will think that the reason is from the woman. Actually, the man very stubborn until he receive the report. I see a lot of men who receive the semen analysis with the not good result, don't have any sperm, and I see in that they regret about that.
Hello, and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Dr. Duy Tam. He's an andrologist at the Men's Health Clinic in Ho Chi Minh City. He graduated with a master's in medicine, specializing in urology from the University of Medicine and Pharmacy of Ho Chi Minh City, and has completed additional training in transgender care and surgery. So, Dr. Tam, it is fantastic to be here with you today, and we're going to talk about a subject you know very well, which is men's health in Vietnam. And so, in getting started, what made you become a doctor, and why did you choose to specialize in men's health?
Yeah, first hello everybody. Yeah, I'm very glad to be here with you, Mr. Bell, and everyone outside. Yeah, I hope today we will have a good conversation about the men's health and men's health care in Vietnam. Yeah, be honestly, I didn't choose to be a doctor when I was young. Yeah, when I asked 18 years old, I had the entrance exam to the university. There are two main reasons why I choose the UMB, the University of Medicine and Pharmacy City, and Pharmacy Ho Chi Minh City. Yeah. The first reason because my family, because the people in my family say that there are all people who work on kinds of job as my family, but nobody become a doctor. So they want me to become a doctor. So okay, I will be a doctor for them. Yeah, but in fact, that my moms and I have a duration to treat a disease of me when I was young. Yeah, when I just 9 years old, I got active hepatitis B. Yeah, and my mom and I will go through the more than 10 years to treat for me. My mom and I have to go to Ho Chi Minh City every month to treat the disease. Yeah, and until my second year of university, I stopped the medicine and the disease is cured. Yeah, so I think that one of the reasons why I feel that I want to be a doctor to take care of myself and take care of my mom in the future. So maybe. And the second reason,
I guess first, before you go on though, so as a little kid, you were diagnosed with hepatitis B,
yes.
And you said you had to come into Ho Chi Minh City. Were you living outside of Ho Chi Minh City?
Outside?
Yeah. Where were you living?
I'm living in Khánh Hòa province.
Khánh Hòa province,
It's at about 350 kilometers from Ho Chi Minh City.
350 kilometers. And so, what was that like having to come to the hospitals? Was it every month or?
Yeah, every month. Every month because I have to go to at the first time it's every month. When the disease is stable, I return the hospital every 3 months. Yeah, to get the treatment. Yeah, at that time, the medicine is very expensive with my family and my mom have to spend a lot of money for me. Yeah, so I think that's one of the reasons why I want to be a doctor, to take care of myself and take care of her. Yeah,
wow.
Yeah, and the second reason why I become a doctor, because I think when we were young, we all have a dream. Yeah, and I think that the medical school is one of the top choice of the student at that time. So I just want to prove everyone that I can do it. So, and I think that if I go into the medical school, it will be a wonderful achievement I can do at that time. So that's the reason. And about why I become a urologist and andrologist, yeah, actually I think that is a destiny with me. Because when I graduate from the university, I think that I will study at a general surgery, pediatrics, something like that. But by chance, I have an opportunity to expose to the andrology. Yeah, and I quickly developed the interesting with the issue the andrology managed. So I love to talk with the patient. I love to talk with them about the sexual life, and I really want to consult some couple which they get the difficulty to have a baby. And you can imagine that the happiness I have if I give the patient my consultation, I give the patient my recommendation and the treatment. And later they come back and they say that I have a baby. Yeah, that's really a wonderful happiness with me.
That's amazing. You're literally helping to bring life into the world.
Yeah, so that I think that's the reason why I feel that grateful and I know the value that the job I am doing. So I want to be an andrologist to do that. Yeah.
Okay, that's amazing. And so you said that a part of the job too is even kind of counseling around sexual health. And I know that in Vietnam that can be very taboo. I mean, same as the US, anywhere else, right?
Yes.
There's a lot of kind of stigmas and difficulties in talking about that.
Yeah.
And so, yeah, like what is the state of men's health today? Like, what are some of the major issues, and also like how does stigma play into getting care?
Yeah, about the state of the men's health care in Vietnam. Yeah, if you make a comparison between the andrology and another department, you can see that the andrology just developed recently, maybe 50 years recently, but you can see that it developed very quickly. And in Vietnam, it's the same with another country. A lot of healthcare and hospital they are repaired and they are built new in Ho Chi Minh City. You can see it recently. And when they are repaired and they build new, they will focus on one department, that's andrology. Yeah, I see that a lot of clinics, a lot of hospital, they have the andrology department. So that means that the andrology is more and more popular with the men and the people. Yeah.
Why do you think that is? Like, why is there such more interest in it now compared to before? Is it just because the specialty has evolved, or is it something about like the culture in Vietnam being more open, or what is it?
Yeah, I think that's one of the reason is the country in Vietnam is more open. Yeah, and the awareness of the men's health improve day by day. Yeah.
I do want to ask about the awareness of like men's health in Vietnam though. So people are becoming more and more aware of men's health issues. Where do they get that information from?
The information from, I think that now the internet and some app internet is very popular now, right now. So the men can search a lot, but actually they have some disadvantage about there are too much information on the internet. So the internet is good. The internet is good because it shows the patient a lot of information and they can search themselves about what they concern. So I think that one of the reasons why the awareness about the men's health increase day by day. But they still have to see the doctor, see the expert about the men's health because a lot of information online is not correct. Yeah,
Yeah.
because when you search something on the YouTube, something like that, about this, especially about the sexual thing, a lot of information.
Yeah, an issue, certainly. So, with all the information and the vast amounts of information that are out there, so what are some of the common misconceptions around men's health in Vietnam?
Yeah, I think there are a lot of misconceptions about the men's health in Vietnam. So I can list something. First, I think that about the mental health of the men, because the men in Vietnam or the Eastern men, they don't worry too much or don't think too much about the mental health. And some men believe that the mental health is the sign of the quickness. It means that the man had to be strong, had to be the because behind his back is his family, so he to be strong, to be brave, and cannot be ill. So and they don't think too much about the mental health. Yeah. But I want to say something about this. Yeah, it's true when we say that the women it gets easier to get some disease such as depression, anxiety, something like that. It's true, but when people have a depression, they often think about the suicide. Yeah, and when they do the suicide, as men, when they think about the suicide, maybe and they do it, and then they will successful. They will get the success. It means that they really death because of the suicide when they get the depression. It on the other hand, the women they maybe they think about the suicide, they do the suicide, but they not often successful. So I think that's more dangerous than when men have a depression than the women. So I think that we must change that thing. So the second thing about the reproductive health. Yeah. The men in Vietnam or the men the Eastern, they with the Eastern culture, the men don't say too much, don't talk too much about the reproductive health because it's the right thing of them. So, but when something wrong happen, it means that maybe a couple, they have difficulty to have a child, and often the men will think that the reason is from the woman.
Oh, they blame the other
Yeah,
partner.
that is a big misconception. Yeah, because nowadays we can see that a lot of research say that the roles from the man and the role from the woman is the same. I mean 50-50. So we have to change about that. Next, I think that the men, they think that they always strong and they like superhero and all the disease cannot touch to them. Yeah, I think that not a good idea for them. Yeah, because I have some patient. I work at the hospital with a lot of department, and I have a patient. He a strong man at home. They, his family, his friend see look at him and think that he very strong, he very normal because he work on the farm on the day, and then he return home and he drink a lot of wine, a lot of beer, and that's normal with him. But one day they feel that just tired, that he just feel tired. So his friend and his family say that, oh, you should go to the hospital to do the first check, because during his life he don't get any checkup of his health.
So
Yeah,
it's really his family that encourages and pushes. He wouldn't go on his own.
Yeah,
even
that's
having
right.
a serious issue.
Yeah, that's
So
right.
the family members also have to be targeted.
Yeah, and just tired, then go to the hospital, do some tests, and the test show that he get the disease. This is the kidney disease, and it's the end stage kidney failure. It really a shock with him and a shock with his family, and it's just tired. So I want to say one more thing about the misconception. It means that the men don't worry about health too much, so they don't do the checkup, don't do the regular checkup or screening, or try to detect early the disease. Yeah, so I think that's some big conception of the men's health in Vietnam. Yeah.
Yeah, that's so interesting. So if the men are usually not the ones to be the first to go to the clinic, or maybe they say, okay, it's my partner who has the the kind of like sexual issue, what is it usually that brings them into the clinic that finally gets them to go and see you?
Actually, have on that maybe have a patient who come with me on their own. Yeah, they find out his problem and they come to see me to talk to me and to find out some treatment for his problem. But maybe sometime I just see the why the women, they come to my clinic, they see me and they talk that I convince him to come to see you, but he don't want to see you. I don't know why, but I talk too much with him, but he don't want to see you. But when I talk too much, he say that just come to the doctor, ask what you want, and tell me again, and return home and tell me about what the doctor say. Something some K like that.
So he'll send his partner to go and see you to ask you about the issue.
Yeah, that's right.
That is so much stigma though for a guy to.
But
Not
some
even
case,
like
some case when I give the wife, when I give the women the advice and some recommendation, and I hope that you can return home again and convince him to come the clinic. Some of them come. Yeah. Yeah. Actually, the man very stubborn. Yeah. Until he received the report, the health report. And I see a lot of men who receive the semen analysis with the not good result. Yeah, maybe don't have any sperm or very lower in the amount of sperm. And at that time, I see in their eyes, and I think that they regret about that. Yeah.
I see. So that's kind of the moment that they realize, okay, this is an actual health issue that I have to face.
Yeah.
I see. And so you mentioned mental health earlier too, and how that also plays a role in treating men and the higher rates of suicide, like completion amongst men.
Yeah.
So how do you deal with mental health issues at your practice?
Mental health, yeah. Actually, I'm not a expert in the mental health, but I know the importance of the mental health with my patient, because almost the sexual dysfunction related with the mental health. Yeah. So when I see my patient, I always talk to them a lot. I want to know about his story and try to solve all things for them. Yeah. Not include the medicine. I think that talk to the patient and so what problem they have. This is more important. Yeah. Because I'm not expert in the mental health, so if I feel that he needs to get a real consultation about the mental health, I will send him to another doctor who have experts in that. And of course, I have some friend who work on the mental health to help the patient. Yeah.
Okay, great. So it's kind of through referral networks that you help to get that solved. All right. And then I also saw that you had specialty training in treating transgender patients, which is
Yeah.
quite a unique population. And
Yeah.
so, can you talk about like the major issues facing transgender patients in Vietnam?
Yeah, about the transgender, I think that maybe transgender is one of the most interesting thing with me when I study about the andrology. Yeah, because andrology are dealing with the transgender and try to help them. Yeah. I think that there are a lot of things to say about the transgender in Vietnam, because first all about the awareness and discrimination in Vietnam for the transgender. I think that still now, although the people accept them more than in the past, but not too much. Yeah, I think that a part of people in Vietnam not accept the transgender, and that made the transgender get more difficult to get the education, to get the employment, and something like that. And so first on, I think I have to talk about this discrimination. Yeah. And the first time when I worked on the mental health center, I maybe in 2 or 3 years, first I don't see any transgender, but then 1, 2, 3 and more come, and then a lot of them. Yeah, it means that maybe in the daily day we can see the transgender, but they still live around us, and maybe we don't know. Maybe we know, especially the female to male transgender. Maybe you don't know. Maybe just staff beside you, maybe he a transgender and you don't know. But the male to female is get easier for to detect him, to find out. Yeah. The second thing I want to say about the transgender in Vietnam is the limited of the healthcare system, which can help them. Yeah, because when the transgender try to find a clinic to help them, it means that clinic maybe they have to get the hormone therapy for them. They have to know and understand about the hormone therapy, and understand about the side effect, especially the side effect when we use the testosterone or estrogen on the transgender to consult for them. And
Are there many clinics that can do this that have high
yeah,
awareness of hormone?
actually, I think that they're not too much clinic can do that. Yeah, so that reason why I list the limited of the healthcare system to have the transgender. Many healthcare provider they lack of the rubber knowledge about the transgender. So maybe they can help the transgender to get injection, maybe, but they don't know understand about the hormone therapy, and they don't consult to the transgender about the how harmful the drugs can match for them, and which symptom or which sign signal they have to follow up when they use the hormone, something like that. And in Vietnam, I know that the government don't allow the doctor to do the surgery, to do the transgender surgery for the patient.
I didn't
Yeah.
realize that it wasn't allowed here because in
Actually, no, we don't have a law for that. But I know that some organization are prepared for the law for the transgender now. Yeah, I very waiting for that law in the future. But now we don't allow to do the transgender surgery. But maybe some surgeries such as we cut the breast, we cut the testicle, something like that, maybe. But it's small surgery. It's not the transgender
like gender
surgery. Yeah,
reassignment. Yeah.
yeah,
So
that's right.
I guess Vietnam is not going to be a kind of medical tourism destination for transgender surgeries anytime soon, huh?
Yeah, yeah. And the third thing I want to say that about the mental health of the transgender, because they abstract too much about the social things, the discrimination, or something like that. So they get easy to get some trouble with the mental health, especially when they use the hormone. Maybe if they cannot control the dosage of the hormone they use, the testosterone and estrogen, maybe it will affect the mental health. It makes him easier to get some problem. Yeah. And finally, I want to say about the family acceptance. It's very important. Yeah, maybe the people outside don't accept me, but my family must accept me. I think that's very important. But now a part of transgender still have a stray relationship with their family, and it affect their emotional so much. Yeah.
Yeah, and it sounds so difficult. And I guess so. That was about hormone therapy for transgender patients. But I'm seeing in other countries there's more interest in just hormones in the general population, like testosterone in men's and optimizing around that. And so, how is general awareness of like testosterone and other like male hormones in Vietnam amongst the general population?
About the testosterone, yeah, I think that about the testosterone is a big problem. If we want to say about the testosterone disorder, something like that, it had a lot of time. But so I try to talk short about it. So testosterone is the one of the most important hormone in men, because maybe many people know that the testosterone affect on their sexual function and just that, but no, testosterone affect all things on our body. Yeah, it maybe affect the physical state and affect the mental state, so on. And sexual function is just a part of what the testosterone affects on. Yeah, and with the testosterone on the men, if in the women we have a menopause, you know that when the women get maybe 50 years, something like that, they will get the menopause, and it's the same as the man, but slowly, because from 30 years, maybe the testosterone level in the man, maybe it decrease day by day, and year by year, it about 1 year it decrease about 1 to 3% per year. Yeah, and maybe they say that the researcher say that maybe after 40 years, maybe the degree, maybe it enough to make the patient have make the man have a symptom of the testosterone deficiency, something like that. And because the testosterone defect a lot of things in our the man body, so have a lot of symptoms, maybe have when the patient has a lower testosterone. First on about the sexual function, maybe they have a erectile dysfunction, they decrease the sexual desire, and maybe it shorten the time of the have sex. Yeah, but in the general health, testosterone make the man, maybe they always feel tired, and they feel that always sleepy and reduce the ability to do exercise. And when we look at a person, a man who have a low testosterone, maybe we very easy to recognize them, because we always feel that they don't have enough energy in his body. So, and one more thing, that when a man have a low testosterone, maybe it get him easier to get another disease. Yeah, and when a man have a disease and have a low testosterone, it get him difficulty to manage on the disease he have. And on the other hand, if a man have a good testosterone level, this is more difficult for him to get the disease. And when they get the disease, it's easier for them to manage the disease. The disease such as one popular disease is a metabolic syndrome, maybe the hypertension, diabetes, obesity, yeah, and lipidemia. Yeah, the testosterone level is related to the degree a lot. So
That's something that I haven't heard a lot of discourse around, is kind of like hormones' effect on chronic diseases, which are increasing.
yeah,
Like, how common is low testosterone in Vietnam now?
actually that now we don't have too much research on to detect how many percent of the men have a low testosterone, but I know that when the people get older and more than 40 years, they often get the testosterone deficiency. Yeah.
So, a lot of these men then go on testosterone replacement, or do they just kind of have to live with it? Like, what is the common
Yeah, of course,
practice
because
here?
yeah, of course, this is one of the major thing the andrology deal with. Yeah, so when the men feel the different in their body, and they feel they don't have the good sexual function anymore, they come to clinic and see the doctor and see the andrologist, and andrologist have talk to them and hear the listen to his story and give us some tests for them, maybe the testosterone level test at the morning to detect the disease. And if the testosterone really decrease too much, maybe we test the testosterone replacement therapy for them. Yeah, in Vietnam, when I treat for my patient, there are three kinds of the testosterone replacement I can do for my patient. First on is the internal testosterone. It means that we can rinse, we can use gel on the skin, or they get the injection to get the testosterone directly to the blood. Yeah. The second, we can use some medicine to increase the signal at his brain, and the signal at his brain will increase the LH level and FSH level, and then these hormone will stimulate the testicle to increase secrete the testosterone. Yeah, and the last one, we can use some herbal supplement or something like that in some case. In some case we can use or we can combine all of this. Yeah.
Okay, I see. And so, like, what needs to be done to improve awareness of men in general around like hormone health? Or it sounds like there's not just hormone health, but going to the clinic at all is kind of an issue getting there. So, what do you think is the best way to get more men to come to the clinics for preventive health?
I think first we have to increase awareness and education for the men and tell them that they don't strong like they think, and they just the people like anyone else, so they have to go to the hospital, do some checkup, maybe when they were young, maybe they don't worry about it, but when you get 40 or something like that, we should have a regularly checkup and find out disease if they have. And the second, I think that we have to encourage their family too, before I think that the family member is one of the people who can convince the man come to the clinic. Maybe when a man see on the TV, see a doctor say that you have to go to the hospital, they, oh, I don't want to go to the hospital. But maybe his wife or his son or his daughter say that, oh, you need to go to the hospital. Maybe they will hear his family member. Yeah. Okay. And I think that the people like us, yeah, maybe the doctor or someone work on the healthcare system, we should do more things, same as the podcast like this, to send the information, to supply the information, the correct information for the patient, to change for them to know about the misconception and change it. Yeah, they need to change it. So I think that some solution I can give you. Yeah, give everyone. Yeah, yeah.
Well, Dr. Tam, are there any technologies that you're excited about that are helping you to treat andrology patients?
I think the mobile app help us a lot because the patient, especially the andrology patient, they often get shy when they see the doctor directly. Maybe they are shy and they don't tell their story completely. maybe but via the phone, and I can see directly the patient cannot see directly me. So they get more confident to tell about their story, and that's the reason why the doctor will collect all the information, and from that we can give the patient the advice, give the patient the recommendation or the treatment for them better.
I'm really happy to hear that you're an early adopter of telemedicine and finding it useful in your practice. And
Yeah.
also that it's helping to combat stigma too, since it's so difficult to get men into the clinic. At least you can come to them through the phone.
Yeah.
Great. All right. Well, thank you so much for this conversation, Dr. Tam. It was absolutely interesting.
Yeah, I hope so.
And so our listeners can find Dr. Tam on Facebook as well as on Docosan. And so thanks for listening, and catch you on the next Demystifying Healthcare in Vietnam podcast.